Okay, well, she is conscious and complaining of minor injuries. She has some scarring on her arms and legs and she is struggling to walk. I think we should admit her to the clinical decision unit for observation. I'll have a look at her records. Jane Simpson, date of birth the 12th of December 1986. No fixed address. Her GP is Dr. Ward at Knocking Shop Surgery. She has been using crack cocaine for 5 years, and intravenous heroin for 8 years. The patient was seen in Rowan Ward for a detox 9 months ago. She discharged herself and could not be followed up. Virological test results show no hepatitis B, but hepatitis C antibodies and genes were detected. Jane, do you remember coming to St. George's before? Jane, you had some blood tests carried out in March. You were in Rowan Ward. I understand that you left the ward and we couldn't contact you. We sent a letter to your GP. Has he spoken to you?
Yeah, maybe.
Jane, the test results showed that you were infected with a virus. It is called hepatitis C virus. We need to take another blood sample from you and repeat the test, and carry out a few more virology tests. We also need to check your liver function.
I've been using drugs for years. I don't know, 10 years? It has got worse. I have to work every night just to pay for it.
We are going to keep you in for a few days until all the tests are completed.
Went to see the GP weeks ago. I wanted to try and come off the drugs. He sent for the hepatitis tests again. He said it was bad, and the hospital doctor had told him that he had to do other tests.
I will contact your GP and find out what tests have been carried out. Then we can talk about other tests that need to be done. The tests showed hepatitis C antibody and genes were detected. Her ALT was elevated but everything else was within normal limits. I better explain this to her. Jane, you are infected with hepatitis C virus, and the infection is not clearing. The virus is replicating inside your blood. The virus can damage the liver, so it is important that you do not drink alcohol, as this can make things worse. Patients who have hepatitis C are at a high risk of developing cirrhosis. I recommend that you have some further tests, including a fiber scan, to determine if you need immediate treatment. You will be treated with ribavirin and pegylated interferon. The interferon will make you feel like you have the flu. But you must continue the treatment for 3 to 12 months for it to have any effect. The ribavirin is taken orally, but the interferon is an injection that you have to take once a week. In a lot of cases, the treatment is successful, and the virus is cleared. Sometimes, if it doesn't clear, we need to take a biopsy from your liver, to see how much damage has been done. But we won't do that at present. Jane has discharged herself from the hospital. Her GP is unable to establish contact.